And then lastly are these language models. And really, these language models, like I said, as soon as they get published, people are using them. Their open evidence is one of the language model that I think is highly sort of regarded among physicians because it does a lot of accurate citation of the quotes that it generates. And they have a statistic on their website that 100 million patients in the U.S. will have a provider who uses open evidence in some form. Now, whether that's marketing for open evidence, trying to drum up investment, I do think that there's some truth to that almost everyone you talk to in medicine has at least used one of these language models. Um, I don't think that they are, um, uh, you know, they I think in my opinion, they serve sort of like an improved search engine. They're able to pull up a lot of evidence, review a lot of literature quickly, and maybe pull some things up that are relevant for someone to review. There's relatively little known about, despite them kind of just immediately being available. There's relatively little known about how well they perform for oncology specific and breast cancer specific tasks, whether it's for symptom management or for clinical decision making. And so I think we need better standardized approaches to assess these just constantly evolving language models to ensure that, however we're using them, we are using the most appropriate model, and that it's just being employed effectively. And then we can, educate patients because, patient may see, data about the effectiveness of these models, and turn to them just as they would for other questions that they have about, other issues in their day-to-day lives. They might turn to these models to ask questions about cancer treatment or their cancer diagnosis. And, we need to be able to provide patients information about what they should be using. Um, these language models are being employed throughout health systems for other tasks, like to automate documentation, to better match patients for clinical trials. The use cases are endless, but I think that we are seeing an evolution in how these models are being employed today.